The staff here was terrific. They had me up and walking with crutches the next day, which was amazing to me. I said, really? I'm going to get up and walk? And I actually did that.
Wow.
And, it's all about the exercising, though. I was highly motivated to do that. I was encouraged to exercise a lot, and that's helped.
Dr. Gomberg.
Well, I could walk about 100 yards, and then I'd have to not walk anymore. And it was difficult. I was in pain all the time. But now, I was going bow-legged because of the both inner sides were losing their cartilage, and now I was about an inch shorter. Now I'm back up to 6 feet after the operation.
No kidding.
My wife's fairly optimistic. She got me a season's pass for next year's Sugarloaf. so
Will that be the first time?
I haven't skied in 2 years because it was just too painful, and I just didn't want to take the chance of doing greater damage. So I really haven't. It was, I couldn't move too much the first really 2 or 3 days. I was just in bed with ice packs on me. But I was getting up every day, and the physical therapy here was terrific right after the operation. They showed me how to get up and encouraged me to get up from the bed and walk with the crutches to keep things moving and loose.
And Wittenberg.
Highly recommended. I'm telling you, I've had a great experience throughout. Well, when I came for a second opinion and first met Dr. Gomberg, he was very easygoing and very knowledgeable and concerned about my knee, both knees. He actually wanted to do one knee at a time, and I said, I want to do two at once. And he said, well, I would do that for you. You're in good enough shape to do that. And I was in agreement. And he was just very easy to deal with. He made me feel very comfortable, got me in a timely fashion, and I was able to get it done. Skiing mainly and playing tennis. I've had to give up both for the lateral movement, and very much looking forward to those two things. And he's already said I can do some biking, which is very nice, some good exercise, and highly recommended, Mr. Gomberg.
You stuff that you're back to.
Well, I'm able to bend and move around the garden pretty easily, and I don't have any pain, which is amazing because I had quite a bit of pain before the operation.
So you mentioned
I had to take vast amounts of ibuprofen before the operation for probably about a year in order to do anything, and I was ready to give that up. So he was very, very good to me.
Excellent.
Highly recommended.
He said, well, what do you want? I said, well, I need a hip, and I've needed it for 40 years, since I was 18. I went to the doctors when I was in high school, and an orthopedic surgeon, and he said, you got a bad hip, and one day you're going to need a hip. They already had it then, and I put it off until now.
Wow.
And he pushed it right through with Mary Margaret, and normally he said it would take 3 months. But I'm all done with it. I can't believe I have it already.
10 days ago.
Yeah, it is. He's an amazing doctor, really. And the operation, the whole thing was pretty amazing.
Your experience here at Park.
Yeah, it's like nowadays you don't see anything like this. You drive up, there's a place to park right there. You go to the doctor's office. It's right in the same building. You go get your lab work. You walk over there. You walk back. It's crazy. I mean, it's not normal for this
in a
day
good
and
way.
age. Yeah, but no, it was a great experience. We're from Connecticut, and everything's really big down there. We've been here 30 years, but no, I liked it a lot. Yeah.
Well, that's great.
No, it was really a good experience. The whole thing.
That's awesome.
And the anesthesiologist, Bill, and the physical therapist, Jeff. The nurses were great. So.
That's terrific.
Yeah. I put up with this for 40 years, and I did pretty well. We'd have a farm and stuff, and then the last year or two, if I like to go hunting, I couldn't walk a lot, and then the last 4 or 5 months, it's been pain all the time, and basically limping afternoon. If I do carpentry work, I'm limping, and now there's pain from the operation. But I can tell I have much more range of motion. I can go like that. That's the new hip. And before, I could only go like that, you know. And it's good. It's really, it's only 10 days. So I think he did a good job.
What are you looking forward to doing?
Well, my physician recommended him. We're from Whitefield, and it's near Augusta, and he used to practice there. And she recommended him. And every place I go, you go to a tag sale, and you see somebody limping, and you ask them what was wrong, and they've been to Dr. Gomberg, and they're like, everybody loves the guy, you know. I mean, he's a nice guy. And she wanted me to try it down here because he's been down here only a few months, and it's been good. Yeah,
That's
I'd
awesome.
recommend it, you know.
Class lasts about an hour to an hour and a half, and what they take away from the class is what to do before surgery. How do I get my home ready? What do I need to do about preparing for meals and putting them in the freezer beforehand? What to expect when I arrive at the OR? How long will I be sitting waiting for my surgery? How long will my family be waiting? And then what do I need to do to be a part of the recovery process once I arrive on the medical surgical floor? And how I can be a part of the pain management. And a lot of our patients, they're in and out within 2 days. Amazing recovery. They find that the class helps them to reduce their anxiety and fear, and they know that they are a part of the whole process of their surgery, their recovery. And the class, it's interactive. So while you're there, you bring your questions. We have a journal that we give to each patient before the operation that they can put their questions in. They bring the journal to the class. They bring the journal to the floor after they arrive, after their surgery. And it helps them to know what information they've been given and other things that they didn't think of before.
A lot of people are watching who...
Well, the book of information talks about how to prepare for your home, how to eat right before your surgery, what to do for exercises to strengthen your limbs and to improve range of motion. But also, you can come to the class even if you don't have surgery or you're just thinking of it. You know, that way you have an opportunity to make a decision that's very informative.
It's free of charge.
Absolutely.
Wow,
and we
great.
have it every other Friday. Just call Parkview and we can set that up for you.
Okay.
And I see patients with disorders of the bones and joints, mainly arthritis of the knees and hips. And I do joint replacement, knee arthroscopy, and fracture work.
With
adults. Sometimes older adults, sometimes younger adults, but anywhere usually around the mid-40s to the mid-80s. We're developing...
Start over, Parkview's.
Parkview's a place where we're developing a great orthopedic program pretty much from scratch. We have a great nursing team and our inpatient care is fabulous and our length of stay is lower, I think, than any hospital in the state at this point.
The patient...
We're trying to make this into what I think is going to be the boutique orthopedic hospital in the state. They were both patients who had significant disease, waited a long time, and were very motivated to get better. Steve was well aware of what he was in for, having both knees done at the same time, and just put a tremendous amount of work into his rehab afterwards. Tom is fairly fresh after surgery, but feeling great, and both of them had a very comfortable hospital stay and went home with little in the way of pain and full mobility.
I know.
Well, as you know, I was in Augusta before and I had a fairly large patient population there, and I think overall I did, I had a nice following and had a bunch of patients who were happy with their results, and they continue to seek me out, which is a nice position to be in.
Yeah.
I think I do several things that are different and better and lead to better outcomes, shorter hospital stays, and a more pleasant rehab experience. And that is, I do partial knee replacements on people who I think can be excellent candidates for a procedure where they keep their normal parts and are young and active enough to appreciate getting back into the game quickly. I do approaches to hip replacement that decrease the rate of dislocation and come with no postoperative restrictions. And we have a very we have a refined way of managing postoperative pain here because I work closely with the anesthesiologists, and postoperative pain has become almost a non-issue.
That's why they're doing something about it?
I think 20 or 30 years ago, it was more acceptable to tell people to take aspirin and slow down. And today, that's not how our culture works. People want to stay active for their whole life, and a joint replacement is a way to do that. Younger people need to know that their joint replacement may wear out earlier, and they may be looking at a secondary procedure later on, but it has been shown that the more active you can stay, the longer you'll live, the healthier you'll be, and the better quality of life you'll have. So there's real benefit to having a joint replacement, even if you're young, when you've exhausted all non-operative treatment regimens.
With what you do.
Fixing people. I mean, it's the reason I went into orthopedics, because it's the one area in medicine where you actually see a patient who has a problem and you fix it. And they're better, and they have a great life, and they're out of pain, and it's very satisfying.
Nice letters. I've seen some of them.
I do. It's nice. It's very, it's really a privilege to have this be my career.